All right, starting with the question itself at the bottom, which of the following risk factors is most likely to have contributed to this patient's condition? So we're looking at risk factors and we're looking very specifically at this patient's condition rather than the condition itself. So we have a 65-year-old man with a history of hypertension and hyperlipidemia. So those are both hypertension and hyperlipidemia can cause a lot of problems. And right now he's having gradually worsening vision in both eyes. It's been going on for a year. No pain, no redness or discharge. Visual acuity does reveal a decrease in his central vision specifically. Endoscopy is going to show yellowish deposits and retinal pigment epithelium atrophy in the macular region. So this is sounding a lot like a macular degeneration.
Okay.
Since it is central vision loss and it's describing drusen. So in his case, we're trying to figure out if it's going to be the hypertension or the hyperlipidemia. I believe hyperlipidemia, so I'm going to go with diabetes. That's my answer choice.
Okay, final answer.
Final answer.
All right. Okay, so this question is interesting, right? So for sure, right? Let's try and take a look at the explanation here, right? For one, right, let's talk about test taking standpoint, right? Just in general, that I like to think about anytime there's smoking. I know this is a very general thing and it's not particularly pertaining to this particular question only. But if you're talking about odds, on step one and step two, if smoking is an answer, it usually is the correct answer. And the reason of why that is because smoking is a risk factor from almost everything.
Yeah.
So, you know, if you want to play odds, that's something that you can play. If you're like, oh, not sure at all. Of course, if you remember something and you know you're confident in your answer, obviously don't pick smoking. But I'm just saying that you know smoking a lot of times is a pretty good bet for a lot of risk factors, right? Cancer, right?
Yeah,
All sorts
that's
of lung
true.
cancer, right? All sorts of that, right? But let's talk about in particular, right? Me in particular, I cannot remember, right? You remember way more on this question than I can, right?
Well,
But
I spent 2 years in ophthalmology, so
okay, gotcha. So I was like, man, like you know your eye stuff, right? Me, not so much, right? This stuff, I'm a little bit far removed from it. Um, but definitely, right? Kind of remembering that it is macular degeneration, right? And one of the key things is that, you know, you do have this drusen, but you know, one of the things is inflammation, right? And remember, the vessels get inflamed with the smoking, which can cause a little bit of macular degeneration. But let's look at the other answer choices, right? Because they're saying this is age-related macular degeneration, but you pick diabetes, right? So
yeah.
more of diabetic retinopathy, and I think it have very specific signs for diabetic retinopathy. I can't remember exactly, but let me see. Let me look it up because I
I think you
cannot
have like
remember.
neovascularization usually.
Yes, and I think they usually in tests they usually use certain other words too, right? Let's see.
Mhm.
Um, Description. Let's see. What do they use? I'm trying to remember the exact test terms that they sometimes use. Let's see. So new vessel proliferation, which he already says, macula edema.
Okay.
And then you can also get heart exudates. That's the one I was looking for.
Ah,
Yeah.
okay.
So yeah, so some of these things, you know, it's the specific terminology that comes with certain questions, you know, it's easy to forget, for sure. So this question, right, going back to this question, um, if I were to change something different and kind of how you approach this question is using the age a little bit more, I would say, especially that guy, the guy 65 years old. Also on top of that, worsening vision bilaterally over the past year. So, you know, he's older, right? He's slowly doing it, right? And they say hypertension and hyperlipidemia. So, you know, sure, almost everyone at this age has, hypertension, so that's not too super important to me. But hyperlipidemia, sure, you can add that, right? But macular region, right? So it's macular
Mhm.
degeneration. So I guess the question is, you should be asking yourself, what is the main cause, or what diagnosis are you going to put this patient with, right? So if you put diabetes, then in the how do I say this? The translation of that is the diabetes, meaning that you're picking his diagnosis to be diabetic retinopathy, right? But here it's
Okay.
macular degeneration, which is slightly different, right? And so then I guess the thing is probably figuring out, here the diagnosis first, and then probably from there you can kind of go back and forth between answer choice and diagnosis, if that makes
Yeah,
sense.
I think with the risk factor questions, the hard part is trying to figure out if it's being specific to the patient or not.
Sure,
Because like the way that I was reading it, uh, diabetes was kind of the only thing that would go with hypertension and hyperlipidemia.
sure, sure,
I mean, smoking would go with hypertension sometimes, but it didn't say that he smoked. So I think that's where I have a problem with the risk factors, is trying to figure out if it's, something that's supposed to be mentioned in the question stem or not.
sure, sure. I think one of the key things here is that that's a good point that you're trying to make. But I want you to look at things that are sensitive versus specific when you're dealing with the
Mhm.
question. So in this particular case, right, what is the most specific piece of information that they give you?
The most specific is going to be the yellowish deposits and retinal pigment epithelium atrophy in the macular region.
Yeah, bingo, right? The fundoscopic exam is the most specific for something,
Mhm.
right? But I would say if you're talking about a broad sense, of course, it's always, I always tell my students to always look at the question as a whole. So of course, the hypertension, excuse me, the hyperlipidemia, yes, that should be put in your mind too. But when they're giving you things that are very specific, right? You give those symptoms or lab values, or images sometimes, right? You give them a little bit heavier weight when
Yeah.
you're trying to pick your answer. So in this case, right, you're like, oh, okay, so the macular, like for me, when I was reading this question with you, I was like, oh man, this is an opto question. This is, you probably know way more about opto than me, which is fine, right? But the way I'm kind of working through this is that the main thing I should be focusing on is the macula. There's something wrong with the macula, right? So then you
Yeah.
say, okay, so I don't know too much, but this is likely in my head macular degeneration. So if I'm looking for a risk factor, I'm looking for a macular degeneration risk factor, if that makes sense.
Yes.
Yeah,
Yeah,
okay.
that does make sense.
Yeah, because if not, then you chose the risk factor that's associated with hyperlipidemia, right? But
Mhm.
the fundoscopic examination didn't, kind of support that it's diabetic retinopathy.
Yeah. Yeah, no, that makes sense. I think I was more focused on his past history than on what his current exam finding actually
For
is.
sure, for sure. And of course, I'm not saying, disregard that by any means, right? But the way I guess in the tiers of way you're thinking about through the logic is the most specific things should be heavier weight. And then of course you
Mhm.
add in all the other things that are sensitive but not specific. Because obviously you don't want to just go off buzzwords, because sometimes the things around the specific thing changes the diagnosis slightly, right? Which can happen.
Yeah.